Okay, so the vaccine that I got for this project is the group beta streptococcus vaccine. A lot of people just call it group beta strep or GBS. So that is the vaccine that I got. It's called a pipeline vaccine because it's still in the works. It's not actually manufactured for the public yet. So let's get into this and figure out what this vaccine is about. So, some information on this disease is that it is naturally in our bodies and it occurs in the genital and in the GI tract. This is actually a big problem for newborn babies because if it is in the genital tract of the mother, that includes the vagina, and a lot of babies are born vaginally. So, when that is introduced to their system, their newborn bodies can't handle it. The These usually causes, like I said, worse infections in adults than in newborns rather than adults. And group beta strep can cause bacteremia, which is a bloodstream infection, sepsis, which is a systemic infection, meningitis, which is an infection of the meninges that covers your brain, so not good. Pneumonia, which is a lung infection, and skin and soft tissue infections or bone and joint infections. This also can be a problem for older adults that have this, especially people with risk factors like diabetes and other health concerns. The history of this vaccine is a little short since it's still in the works, but in 1938, group beta strep is identified as a human pathogen. It became a leading issue causing infection in neonates in the 1970s, and then by the 1980s, the group beta strep was estimated to cause 2 in 1,000 neonate deaths. And so by 2002, they had already done the genome sequence for this group beta strep bacteria. And then in 2014, WHO, or the World Health Organization, met to develop this vaccine to make a meeting about the development of it to see if that's something they'd want to do. And then in 2017, Pfizer, a big medical company, began to start phase 1 on the trial. Currently, they're still working on it. But that is a very interesting history that we had such a big jump from 1938, 1970, and 1980, and then to 2002. So it's been a long time coming. So this vaccine type, currently there's not necessarily a type because there's not one actually manufactured, but the one that they have been researching is a protein subunit and a capsular polysaccharide conjugate. So they have tried both, and so we're not sure what the actual vaccine is going to be at this time. Who gets the vaccine? So I have a cute little picture here of a pregnant lady. So most of the time this would be pregnant women so that they do not pass that along to their neonates. All pregnant women have to have a group beta strep test done to see if they are a carrier of this bacteria. But if they are not, then they wouldn't have to have the vaccine. But if they are, they'd go ahead and give these women the vaccine so they don't pass it along to their babies. Older population, if they have conditions making them at risk. And newborns, in case for some reason their mother did not get the vaccine, but they were a carrier of group beta strep and passed it on to their newborns. The schedule and booster information for this, there's little information about the schedule of this or if there's going to need to be a booster, but at this time we can just hypothesize that whoever needs it is going to be able to get it once it is created. Whether or not that they're going to need boosters after that, it is uncertain, but we can hypothesize that babies as well as pregnant women, older population, that they can all get this vaccine. Side effects and concerns. I've got a little guy here saying, we don't know. Right now, it's just too early to tell what these side effects are going to be. So that is the biggest concern, is the unknown. The concern of the unknown is the biggest issue with these women that are in these clinical trials. Vaccine manufacturers and availability. There's no readily availability right now, but Pfizer is working on it. Other information that I thought was helpful was that the group beta strep is the leading cause of severe invasive disease in neonate, elderly, and the immunocompromised patients worldwide. And that was a fact from 2018. So that's not that long ago. And then also that even though there's been many advancements in prevention in this disease, since like I said, they do test pregnant women and so that they can give these antibiotics to babies, it is still the major health issue with infants. And then I have my works cited page. I really only I had two very, very large articles from this NCBI that really helped me. So I just have those two and then one from the CDC. Thanks.